Menopause, in essence, is when the female hormones estrogen and progesterone drop to very low levels. It's the end of a woman's reproductive life. It's never too late. It doesn't matter how old you are, you can potentially get great improvements with a product like Emepelle.
Let's talk about smart longevity strategies. As a Gen X mum, founder and podcaster, my days can be long and demanding. That's why I love learning about longevity and cellular wellness breakthroughs that work hard and smart. Time Capsule by Melrose Future Lab is the first TGA-listed all-in-one longevity supplement. It combines 12 clinically backed ingredients in one daily formula to support energy, metabolism, cognition, cardiovascular health, bone strength, and antioxidant protection. Powered by Lipisperse and Verisperse for enhanced absorption, it includes niacinamide riboside for cellular energy, resveratrol antioxidant defense, and berberine to support glucose metabolism. Plus essentials like activated B vitamins, magnesium, vitamin D3 with K2. Because real longevity is not just about one thing. It's sleep, nutrition, mindset, and yes, supplements. It's about everything working together. Time Capsule makes it simple. What if the most overlooked organ in menopause was your skin? Today's episode is for anyone navigating the invisible yet deeply felt changes that occur during perimenopause and menopause. You may have heard about the hot flushes, the mood swings, or disrupted sleep. But what about the skin? If you're following along Menotalk, you would have heard the buzz around estrogen cream being used as skincare. I know I've had a lot of DMs about it. The jury is out on this one, and many people who are leading the charge have no qualifications to make these recommendations. Today, I'm delighted to host a conversation with a true expert. Joining me today is Dr. David Kosenko, Head of Medical and Clinical Training at Dermacosmetica, President of the Cosmetic Physicians College of Australasia, and a cosmetic physician with over 30 years of clinical experience. Dermacosmetica are the proud exclusive distributors of Emepelle skincare, which we're going to talk about. His work spans general practice, dermatology, menopause medicine, and cosmetic procedures, placing him in a unique position to explain how our skin evolves as hormones shift and what we can really do about it. We will unpack what estrogen does for our skin and what happens when it declines, why skin ages differently and more rapidly during menopause, how to separate fact from fad in the world of menopausal skincare, and what is emerging in the science, including a new class of skincare, Emepelle, powered by MEP Technology. This is a non-hormonal but clinically proven innovation that helps to rejuvenate skin affected by estrogen loss. If you're wondering why your skin feels drier, duller, or less responsive to the products that used to work, this conversation is for you. This episode is in partnership with Emepelle for Menopause Awareness Month. Dr. David Kosenko, I'm so excited to have you in virtual studio with me. As I said to you before, I've seen you speak at various conferences. I've heard you present at various media events, and now I have you here on the show. Welcome.
Thank you so much, Bahar. It's lovely to be here. Thank you for the invitation. And I look forward to our chat.
One of the things that I know you're very passionate about, and the reason that I invited you on the show, is that you really, really love to talk and educate women around what happens to their skin during menopause. And you very correctly pointed out in some of the lectures that I've heard you present, is that, you know, a lot of people think about menopause in terms of hot flushes or mood swings, but we don't actually realize the profound effect it has on skin and skin aging. And with research showing that we lose up to 30% of skin's total collagen in the first 5 years after menopause. What is happening?
Wow, that's a really complicated question with a longish answer. I'll try and make it as short as I possibly can. So menopause, in essence, is when the female hormones estrogen and progesterone drop to very low levels. It's the end of a woman's reproductive life. And generally that happens around the age of 50 years. It's defined as 12 months since your last menstrual period. And then you're in a postmenopausal phase. So when you think about the fact that the female hormone levels drop so low, you can imagine that the impact that it has on a woman's body is really very significant. And it truly affects every part of the body. Yes, definitely affects the skin, and we'll get into that in a little bit more detail in a moment. But it affects the bones, it affects the muscles, it affects the cardiovascular system, the gut. And so,
And the
whilst women
brain.
often
I mean,
associate
for me, it was just the
and the
brain.
brain,
Like,
of course. Yeah, so it affects everything. And whilst people often think about hot flushes and the period stopping, women are often unaware, like brain fog or difficulty concentrating or poor memory or lack of get up and go from anxiety symptoms. They all can occur as a result of menopause. But things like palpitations, indigestion, the whole lot. So it's really, really important to look at what's happening during menopause and obviously address all of those symptoms, but also understand what happens within the skin. The fact of the matter is that 100 years ago, the average life expectancy of a woman was 65 in Australia. Now it's 85 plus. So a bigger proportion of a woman's life is spent postmenopausal. And, you're really living in an estrogen deficient state. And so we need to try and understand that and do whatever we can to make sure that the quality of life that a woman has is as good as possible, both from a physical and health point of view, but obviously from a skin perspective and the way you look as well. Because I think, appearance is very important for our self-confidence and self-esteem. It's not just about trying to look someone that you're not. It's, we all take pride in how we look. And I think whatever we can do to help is really important.
I think one of the things I've learned through, educating myself more around menopause and the postmenopause period is that estrogen isn't just a reproductive hormone. As you said, it plays a vital role in so many other things, including keeping our skin hydrated, including keeping it plump and resilient. And when that level drops, what happens is that you start to see like many more visible signs, like the dryness, like the lines, like wrinkling, even before we realize we're in perimenopause. So why is estrogen so critical as a hormone for health, and how does this loss manifest in the face and body?
So the highest proportion of estrogen receptors on the skin are on the face, the scalp, and in the vaginal area. And so it's not surprising that if you take estrogen away, those are the areas that get impacted the most. And you may see that through hair changes, obviously the hydration and the lines and the wrinkles and the quality of the skin of the face, but even oil production changes as a result of the change in hormone levels. And obviously women would be acutely aware of vaginal changes that occur as well. Ultimately, it's because that's where the estrogen receptors are. And that's really what differentiates, say, a man's skin from a woman's skin. Females have that nice, soft, plump skin. Men's skin's more coarse and has a different quality about it. And I guess if you think about it in those terms, it helps people to understand the differences.
Why do you think that the skin was left out of the menopause conversation for so long? Then, gave rise to people doing do-it-at-home remedies. The first time I became aware, for example, and you mentioned vaginal dryness and urinatory symptoms of menopause, but one of the things that I started hearing on TikTok, on social, was a lot of women were taking their vaginal estrogen and starting to apply it to their skin because they saw that if they were using an estradiol gel on their forearms, the skin was getting better. Or if they were using vaginal estrogen, they were experiencing better skin quality. And then they went, well, how about I start rubbing it on my face? And I've had this conversation with Professor Goodman. I've had this conversation with Dr. Doris Day in the US. I think it's really interesting that, we are so desperately looking for a good solution beyond traditional skincare that we're willing to put something that's a medicine on our skin with the hopes of getting a better outcome. But my question to you is why hasn't there been more advancement in addressing menopausal or postmenopausal skin?
That's a great question. I actually think that we all assumed it was just part of aging.
Mm.
You know, you just get older and your skin changes, your hair changes, you get more dryness, more lines, more wrinkles, and loss of elasticity. And I think for a long time, people felt that it was simply a result of aging, which it sort of is because the hormonal changes are part of aging. But I don't think there was an appreciation of the impact that that drop in estrogen would have on the skin in itself. I don't think we really understood that well. And I'm not sure why, because like I said, we know that men's skin and women's skin is different. And if you think about it, you can sort of say that a postmenopausal woman sort of starts to take on the qualities of a man's skin, if you know what I mean. Just those
Coarseness, the
feminine
dryness.
characteristics. Yeah. So I don't know why we didn't put two and two together because, you know, in retrospect, it seems fairly obvious.
And the industry
But
is
the good
always
thing is
looking
that we
for,
have.
sorry to interrupt you, but I was going to say the skincare industry is always looking for a breakthrough ingredient, always, like where, you know, once it was antioxidants from grape seeds or grape stalks, then it was, at the moment, it's exosomes. But as you said, it seems kind of obvious that postmenopausal skin and perimenopausal skin is depleted in estrogen. Estrogen helps all those signs of aging. Therefore, wouldn't estrogen be, or some form of an estrogen boosting molecule be exactly and probably the first thing the skin needs? And I'm going to, I guess, open the conversation for a product that you have introduced me to, which is Emepelle. And this is probably the only skincare brand that specifically focuses on that technology. And I would love for you to share with me like what it is and how it's different to what I described before, which is taking your HRT and rubbing it on your face.
Yeah. Look, HRT, the topical estradiol rubbed on the skin is effective, but it's not designed for that use specifically. And it is an estrogen. And so you apply it on your skin, on your arms or your abdomen because you know it gets absorbed and therefore is a form of HRT systemically throughout the whole body.
That's right.
And the same thing's going to happen when you're applying it to your face. So the first thing is that not all women can use HRT. You know, for example, if someone's had breast cancer or they've got an estrogen dependent tumor or something like that, then you need to use estrogenic compounds very, very cautiously. And most of the time you wouldn't use them at all in those sort of situations. And because those preparations aren't designed for cosmetic or an aesthetic use, they're not necessarily going to give you the best outcomes on the skin. There's even been some concerns about getting telangiectasia, which is small broken fine blood vessels as a result of ongoing use of those products. So Emepelle is interesting because it contains a molecule called methyl estradiol propionate, which is not a hormone. It is a molecule that binds to the estrogen receptor in the skin and stimulates an estrogen-like response. But the beauty about the molecule is that the minute it enters the bloodstream, it's broken down into inactive metabolites. So you don't have this estrogenic effect throughout the whole body. It's just literally limited to the skin.
So what you were saying before is the HRT is systemic, but the Emepelle is very, very targeted just to the skin cells.
Correct. Absolutely. And that's the main feature and benefit, other than it being formulated in such a way that it's primarily designed for peri and postmenopausal skin. Because I think all those other skincare things you were talking about are really important. You know, just because you reach menopause, you shouldn't just stop using your antioxidants or your retinols or the other compounds, but you just need something extra.
And this MEP technology, this is what's powering the Emepelle. So it's got all the humectants, it's got all the skincare benefits that you kind of demand from skincare, which is hydrating, protecting, regenerating. But then the MEP technology is what binds to the estrogen receptors and mimics what a good estrogen juicy skin would do. Is that correct? How's my citizen scientist going?
Pretty good, really. So MEP is the specific molecule within the Emepelle range that binds to the estrogen receptors. but there is a day serum, a night cream, and an eye cream in the range. And it is combined with other products, other molecules that are very, very useful in maintaining the health of skin. So you've got retinol and niacinamide, peptides, a whole heap of other things in there which will make the skin look better, feel better, and have those other benefits you want as well. So it's a very clever way that they've combined the ingredients so that it's basically everything you need in a very simple skincare range.
I have a special ageless listener offer. Ready to simplify your longevity stack? Our Season 11 sponsor, Melrose Future Lab, is offering ageless listeners 40% off your first time capsule order. Just use the code AGELESS at checkout. T's and C's apply. Offered valid on one-time purchases of time capsule. Only available now at melrosefuturelab.com.au. You know, the first time I discovered Emepelle, I think I was at the ASCD, which is the dermatology conference in Melbourne. And I think I got a sachet of it, and I get sent absolutely every single skincare product in the world. Like you name it, I get it. I get it sent. Media, they want me to consider it, review it, talk about it. And I remember thinking, oh, it's just a sachet. Anyway, I had this sachet with me, and then I had to go to Hong Kong for Cosmoprof, and I needed a moisturizer, and I used the Emepelle. I think I had a sachet of the serum and a sachet of the day cream. And it was like my skin was having a big drink of water. It was so lovely and so easy, and it didn't stick. It just hydrated so well. And when I came back, I contacted the PR for the company and I said, oh, do you think you could send me a jar of it? I actually really want to try it. It was so beautiful just off the sachet. And then I didn't realize it was just a 3-part skincare, which is pretty easy. And I appreciate that. I don't want 50 million new things to squeeze in. But could you share with us, one of the things that I learned when I called in the product is that there was a 20-week study on the effect of Emepelle on the skin. And I was wondering if you could share with us that, because for me, from the first time I used it, I thought, no, this is different to other creams I've tried. But the 20-week study is really compelling.
Sure. Look, I think that's really important to recognize as well. At Dermacosmetica, we pride ourselves on choosing products that have got scientific evidence behind them. We like to be able to offer products that we know are going to work. And Emepelle, I classify Emepelle as a high potency therapeutic skincare product. So it's not a cosmetic. And I'm cautious about getting people just to retail it off the shelf. I think it needs to be prescribed by, whoever your skincare professional is after consultation with you, because it has high potency actives in it. Some people need to have it introduced slowly. Some people with certain sensitive skin types should have that sensitivity addressed first. Once people get onto it and they can tolerate it, and most people can, don't get me wrong, the results are outstanding. And going back to the study you're referring to, Zoe Dralos is a dermatologist from the USA who was involved in the development, did 2 studies. The first study was to measure the tolerability of the MEP molecule that we were talking about a little while ago, and just to make sure that it did in fact break down and had undetectable levels in the blood after, I think it was 12 weeks for the initial study. And that was sort of a proof of concept that what they thought would happen actually happened, that you wouldn't get those generalized effects throughout the body, estrogenic effects throughout the body. And then that was followed up by the study you were talking about, where they used it for a longer length of time to see what effects it would have on the skin. And most of they looked at whether people were getting adverse events, how well it was tolerated, what the lines and wrinkles looked like, what the report from the subjects was, did they like it and did their skin feel better? And so the results of that study were very encouraging. It showed low rates of adverse events, obviously with appropriately chosen subjects. And it showed that even women who were clearly postmenopausal in their 60s were getting benefits as well. And it's probably one of the few skincare products I've come across that's actually been able to show that in a study. Yeah, so it's lovely to have that sort of paper backing you up when you are trying to talk to someone about a product and why they should consider using it.
I wanted to have this conversation on the show because, as I said to you, there's so much noise around using estrogen as a skincare additive, slipping it into your skincare routine. And I thought, okay, well, I had heard of Emepelle. I am interested in it. I have used it. Do you know where I noticed the biggest difference? I noticed it on my neck because I do so much to my face anyway. I am postmenopausal. I had menopause early. I didn't realize I'd had my menopause. I had it when I was 45. I figured it out when I was 47. So I was already 2 years too late to jump on HRT, which I eventually did. So I've been working really hard to preserve the collagen that I have, to induce additional collagen and elastin. And, I've had Profilo, I've had laser, I've had other biostimulators. And I really take care of my skin because and I take collagen supplements too, because I'm acutely aware that there's a nosedive in the natural collagen that I'm generating. But the area that I don't treat as, specifically is perhaps my neck. And so when I was using the Emepelle, I was taking it down my neck and I saw a remarkable improvement in the crepiness, in the fine lines. And I went, okay, now I know this works. This is working for me. And so then I started putting it on the back of my hands. And then I saw an improvement in the back of my hands. So I do a lot of my face. So I couldn't see that big, but like on my neck and back of my hands that I don't do a lot. That's where I did my own little scientific experiment, my lab. And I saw a good improvement. I want to go back to what you were saying before about the combination of ingredients. And you said, you don't give up on the other active ingredients that you need for good skincare. So can you take us back a step and say, okay, what would a good skincare routine look like from the perspective of rapid collagen decline in a perimenopause or menopausal state? And what other treatments do you recommend that really deliver?
Yeah, sure. I think it's important to understand what we need for our skin changes as we age as well. And I think if we talk in general terms, people will often comment that perhaps when they were younger, their skin was quite oily, very acne prone. And then when you talk to a woman at the other end of life postmenopausal, she'll report that her skin is actually quite dry and is lacking that oil. And I think one of the traps that we can fall into, we might find a great skincare routine when we're in our 30s, which might contain some retinol, some niacinamide, some antioxidants, vitamin C, or superoxide dismutase, or ferulic acid, or whatever it might be. And because it works at that time, we continue to use it. But we don't always recognize that as we age, our skin changes. And so our skincare needs change as well, which is where Emepelle comes in. So I think that's the first thing we need to recognize. Just because you've used something all your life and it's worked really well, if there's a change in your skin, you need to look at why that is and refine your skincare to be what your skin needs at that particular time. The other products with Emepelle, like I said, it's a therapeutic skincare range. So the day serum really has a lot of things in it that people would generally tend to be using as a day cosmeceutical skincare anyway, which might be niacinamide, might be vitamin C, might be peptides. The night cream, which is very nourishing, it's got a beautiful texture to it, very hydrating, as you noticed. That has got retinol
Do you
in
know,
it as
I've
well.
used it as a mask before. So what I've done is just put it on, just left it, and then I've tissued it off. I got it all excited because I really love the texture.
Yeah, I mean, you use it the way that it really works for you. And the eye cream's got specific ingredients that help with the darkness and the fine lines and wrinkles around the eye as well. Some skin tensors to try and help to reduce those lines. So the range is really well thought out to sort of be a complete range. You ask, what else do you need in addition? I think you need to think about the cleanser you're using. And people often think, oh, yeah, look, I can use any cleanser. But you need to really think about the sort of cleanser you're using. So if you're getting older and your skin is drier, you're not going to want to use something that's going to strip all the oils out of your skin anyway. And I'm a big fan of oil-based cleansers and micellar water. I think they work very well without leaving the skin dry. And you need an appropriate sunscreen as well, because the other big factor in aging is photo damage. So you asked earlier, why didn't we recognize estrogen deficiency as being a factor? I think we all thought, well, we're getting older and we've spent all this time in the sun. No wonder we look the way we do, without recognizing there was that extra little bit there. So I think a sunscreen's the other thing.
Do you think that there's going to be a rush into this space where, skincare preparations are going to claim that they've got some estrogen molecule receptor, because it really is, the conversation around menopause is getting louder and louder and louder, and women are demanding more solutions, more conversation, more R&D to go towards women in menopause. That demographic, it's my core demographic for the ageless audience, for the ageless events, for everything that I do is really speaking to that woman. And when I have my events and when I have the podcast roll out, the greatest response, and we're recording this for World Menopause Month, actually, the greatest response is to this very, very topic. And the question that I get asked is, why is it only now coming out? We are the highest financially, mobile group of consumers in the world. Over 1 billion women are going to be in menopause by, I think, the end of this year, 2025. And why are we only just talking about it?
Again, great question. And there's several things that I might touch upon. I'll start with the last bit first, maybe, as to why we are where we are at the moment. And I really think that the Women's Health Initiative study in 2000, which stopped basically the use of hormone replacement therapy for 10 or 15 years in 2002, is a major reason why we are where we are now. Basically, it didn't even stop. It went backwards.
It really did.
Menopause became a taboo topic. There was no way of managing it. All the treatments were terrible. They caused cancer. They caused heart disease. You just wouldn't want to touch it. And it's really a pity the way that came out, because that really did have a devastating impact on women's well-being, but also an impact on the education that doctors had as well. There's a whole generation of doctors who went through medical school and training believing that there was no effective treatment for menopause because whatever you did was putting women's health at risk, when in fact the opposite is true.
You talked about the generational aspect of education when it comes to menopausal skin. And, I asked you the question, why is it that, or rather I asked, do you think that there's going to be like a rush of products in this space? What do you think is going to happen? Like, what other tools do we have at our disposal? We've talked a lot about Emepelle skincare. We've talked about HRT and to rebuild the collagen, the estrogen stores in the body. What else can we do?
I think there'll be a rush, and I think we're witnessing that at the moment. I mean, if you look at the momentum behind menopause in general, it's really accelerated over the last couple of years. 2 years ago, there was no menopause conference and there were very few talks about it, very few workshops, and now, they're very common. And so I think there is a huge interest, and I think that's a great thing. I think people are looking at all sorts of different ways to address menopausal changes. For example, if we're talking about skin in particular, people have always played around with other products that they felt would have estrogenic effects, like isoflavones and soy and things like that. My concern with those products is that I don't think they have the same sort of studies backing them up like Emepelle and MEP does. And there's this lingering doubt in the back of my mind that if you're using something, even if it's from a plant that's going to trigger an estrogen receptor, do we know with any certainty that you're not going to get systemic estrogenic effects?
Oh, I never even considered that.
So if you've got something that triggers an estrogen receptor, I would think the first assumption is that is going to have generalized estrogenic effects, unless you can prove that it doesn't. And so, I would exercise caution in using those products, A, because we don't know how well they work, and B, despite the fact that they're so-called natural, we don't know what other effects they have. Let's face it, I sort of tongue-in-cheek always remind people that things like heroin and cocaine and tobacco are natural as well. So just because something is just plant-derived doesn't mean that it's safe to use or that, it's the best thing to use. And I think with regards to addressing other skin issues, I think we're entering a very exciting stage in aesthetics. There's a lot of interest in regenerative aesthetics, and in particular what I've sort of labelled physiological regenerative aesthetics. So getting tissue regeneration without injury, through direct cellular responses by triggering the cells physiologically. And I think that's where we'll see a lot of advancements in the next 20 years. And I think that's very exciting. For the first time, we won't have to damage ourselves or injure our tissue with a laser or microneedling or whatever it might be to get the beneficial effects of increased elastin and collagen production. And I think that's where I see the future going. And even more so, I think we're going to start treating the skin from the surface and from within and from underneath, as well as the various anti-aging, anti-inflammatory things we're going to do to our bodies to try and live healthier for longer. It's really a great time at the moment. There's some really great progress being made.
Well, I love to end things on good news. And I would like to ask you as our final question, what is the one message that you hope women will take away from this conversation, especially if they're in perimenopause or postmenopause and they're looking at their skin and just, wishing it wasn't so?
I think, and this is another bit of good news that we didn't talk about before, the number of estrogen receptors in your skin in the postmenopausal period decline as you get older. And quite remarkably, if you trigger those estrogen receptors, if you put an estrogenic compound like MEP on the skin, it actually has a positive feedback loop. And so the number of estrogen receptors increase the more you have estrogen present. And so the really cool thing about that is that you can be in your 60s and you can still get that improvement in your skin. It takes a little bit longer because the first step is to increase the number of estrogen receptors in the skin. But once they're increased, products like Emepelle have this fantastic positive effect on the skin because the receptor is there, the MEP is there, and you're just getting this great result. So my last message is it's never too late. It doesn't matter how old you are. You can potentially get great improvements with a product like Emepelle.
Well, that's fantastic news. And I love it. The estrogen party has begun. You can have it internally, you can have it vaginally, and now you can have it on your skin. And it was just such a beautiful conversation, particularly on the theme of World Menopause Month. I always love hearing you speak, and I love the way that you break down the science into bite-sized pieces, but you always teach me something new. And it was just a true joy and honor to have you on the show. Thank you so much.
Thank you for the invitation. I've had a lovely time talking with you. Look, I'm passionate about this sort of topic and I love talking about it. I love sharing my knowledge and the information that I can. And I do like trying to make it very understandable. I think knowledge is power, and if you can get everyone to understand what's going on, it's beneficial for everyone.
Thank you, Dr. David Kosenko.
Thanks, Bahar.
Thanks for listening. If you enjoyed this episode, please subscribe to the channel, sign up for our free newsletter, and consider leaving a review and rating it. This really helps the channel grow and reach new audiences.